Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, the Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. Today, I am pleased to report that 6,624 Albertans have recovered from COVID-19, leaving 328 active cases in the province. Currently, 44 people are hospitalized, with 6 of these in ICUs. In the last 24 hours, out of 6,455 new tests, there were just 7 new cases. I am happy to report no new deaths today. Today's numbers mark an occasion to be celebrated. Not only are we reporting the highest number of tests done in 24 hours in the province, we also have the lowest daily number of new cases since March 12th. The number of active cases in our province continues to trend downwards. This is in large part thanks to your efforts and sacrifices. One especially difficult sacrifice has been being unable to visit our loved ones receiving care in hospitals. Though this restriction was made to protect the safety of patients and our healthcare workers, I know this has created hardship. As the COVID-19 pandemic has evolved, we have continuously monitored the situation and adjusted our measures as necessary. Effective tomorrow, Alberta Health Services will be releasing updated visitation guidelines for all patients in both acute, outpatient, and inpatient settings. These revised guidelines expand the allowance of some visitation while maintaining specific criteria intended to protect patients, residents, volunteers, and staff. For more information, you can access the updated guidelines from AHS's webpage. I want to be clear that these guidelines only apply to hospital settings. The existing standards and rules for continuing care remain in effect. We know that visitor restrictions in continuing care are a hardship in these settings as well, and we will be seeking input from residents, families, and operators on how we can balance needs for connection and needs for safety in these settings so we can continue to make adjustments in the best interests of all those in these settings. As we prepare to move into Stage 2 of Alberta's relaunch and more activities in our society resume, we must continue our basic prevention measures to keep our numbers low. Although we can expect to see some fluctuations in new infections and outbreaks, it is possible for us to collectively keep our numbers stable. If everyone practices good hygiene, stays 2 meters apart when that is possible, and wears a mask when it is not, that will help reduce the spread. Our pandemic response will help to keep Albertans safe during relaunch. Today, I'd like to talk about 2 key objectives for our pandemic response and what you can do to help keep each other safe. The first objective is enhancing our testing and monitoring of the virus. Strategic and widespread testing is crucial to discover cases before they have the chance to spread. Our public lab system has done a remarkable job to build its capacity, so now we are able to provide testing to anyone in Alberta with or without symptoms. Even if you are feeling well and showing no symptoms, I encourage you to complete the online assessment and book an appointment for testing, or go to one of the drop-in testing centres available in Edmonton or Calgary. Most importantly, anyone who has symptoms of COVID should stay home and arrange for testing as soon as possible. This makes sure that we can keep our case numbers low, since if an infection does happen, it's very important to find out if any exposure has occurred and to take immediate action to contain the spread. This is done through contact tracing, where a public health nurse or other allied health professional investigates if and where exposure might have occurred. These investigators can then contact at-risk individuals and get them to isolate before the virus has a chance to spread any further. You can help us in this critical, time-consuming detective work by downloading and using the province's contact tracing app, AB Trace Together. By using this app when out in public, you can help identify potential sources of exposure. Should someone you were in close contact with get COVID, having this app makes it more likely that you will be notified of this so you can isolate and get tested to break the chain of transmission. AB Trace Together is voluntary, free, and your data will not be used without your consent. It's important to remember that while the danger from this virus is low for most of us, we know that the virus can have severe consequences for older people and those with some health conditions. This brings me to our second objective, protecting each other. Current data shows that over 90% of those who died from COVID-19 and about 2/3 of those who were admitted to ICU had at least one underlying health issue, such as high blood pressure, diabetes, or a history of smoking. Older age is also a common characteristic. People over the age of 70 represent the majority of deaths we have seen. Because of this, we've taken additional measures to protect those most at risk, such as seniors living in long-term care. These measures are important, but by themselves they are not enough. Not only because there are many seniors and individuals with chronic medical conditions living in the community, but also because keeping seniors in continuing care strictly isolated from the community for long periods of time is negatively impacting other aspects of their health. Our success in protecting Albertans who are at the highest risk of severe outcomes rests on our collective action to keep our numbers low in our communities. When each one of us takes pride in our individual actions to keep our communities safe, this keeps our elders and loved ones protected in all settings. Think about who you are protecting when you stay home if sick, when you wear a mask, when you keep 2 meters away from others, and when you keep gatherings small. We continue to all be in this together. On that note, I was pleased to hear this afternoon's announcement of 200 additional short-term ventilators donated for Alberta's COVID-19 response. I want to thank Exergy Solutions, Suncor Energy, and our other partners for this wonderful gift. Thanks to ongoing efforts by Alberta Health Services and this recent donation, we are well positioned to meet the COVID-19 demand should we experience a second wave as we move forward with relaunch. While our health system continues to prepare, you can too. As Alberta continues to relaunch, it's important that we all keep considering what we can do to protect our family members, friends, and neighbours. Let's keep everyone healthy and ensure Alberta's relaunch continues to be successful. Thank you, and I will be happy to take questions.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Vice President and Medical Director with AHS, available if needed. Operator, can you put through the first caller, please?
First is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. I know you've been hearing from recreation and fitness businesses asking to move up to Phase 2. So I'd like to know what is holding them back in Phase 3, and when will we learn when these businesses can reopen? And in addition, do you still expect that Phase 2 will start on June 19th?
So final decisions about Stage 2, including the timing of the beginning of Stage 2, as well as exactly what will be included in Stage 2, is anticipated early next week. And so the questions about sports, fitness, and recreation, as well as the timing, you can expect, again, early next week for there to be an announcement of the final decision on that.
Operator, can you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Last week you announced the first possible case of MIS-C in the province. Has that case been confirmed, and have any more cases been reported? And then a quick question for Dr. Jaffe. I know these guidelines are to be released tomorrow, but what can Albertans expect from these updated visitor policies?
Sure. So that first case of MIS-C has been confirmed as meeting the criteria. And I have not had any other cases reported to me in the province. So we continue with one officially reported case of MIS-C, and that individual is now recovering at home. I'll let Dr. Jaffe speak to the guidelines.
Thank you for the question, Julia. We know that it has been challenging for Albertans to have loved ones in hospital and to perhaps not be able to visit with them. Similarly, in outpatient ambulatory care clinics, It can be difficult if someone is accessing care and can't have a support person with them. So the guidelines, the updated guidelines, will be posted on the AHS website, ahs.ca/visitation. And so the updated guidelines will be posted there. But in essence, what will be permitted starting tomorrow is for ambulatory care visits. An individual coming for care to an outpatient clinic can be accompanied by one support individual. And for hospitalized inpatients, 2 designated support individuals can be identified so that they may visit at the same time. As long as there is space for both to visit at the same time, they can visit. There needs to be maintained physical distancing. They will be required to have a health assessment to ensure that they are healthy and able to visit the hospital, because we do need to protect our staff and other patients in the facility. And they will be asked to wear a mask and potentially other personal protective equipment, as well as to perform regular and frequent hand hygiene.
Thank you. Operator, can we put through the next question, please?
Chris F. with CTV Calgary. Go ahead, Chris.
Thank you. Dr. Hinshaw, this week we had protests in a couple cities with thousands of people, most wearing masks but not really distancing themselves. I'm curious that if in 2 weeks we don't see any ramifications of this, no outbreaks, no uptick in infections, does that mean that, everything else could be expedited? Because clearly we've had a critical mass of people and no virus spreading. How close are you watching the results of those crowds?
So we know, I've certainly seen, not just here, but in many places around the world, and especially in North America, large crowds gathering to protest. We continue to recommend that anyone who's engaging in that act, that they make sure that they assess how they're feeling. If they're sick, that they do not attend, that they stay 2 meters away from others at all times and wear a mask where that's not possible. So your question about whether or not the results of these, if we don't see super spreading events, whether or not that might help us determine whether we can open anything up further. I think we are continuing to watch the results, not just of protests, but of all of our relaunch activities to determine what activities are the highest risk and which activities could possibly go ahead. And so, again, you'll see more details early next week about what's happening in stage 2. So it won't be this won't be the only activity we'll be watching closely. We'll be watching really all other expanded activities as those start to roll out. I think it's really important to remember that an activity's risk is calculated or can be assessed based on multiple things. One is certainly the distance between those who are attending, whether or not they're wearing masks, whether or not people actually stay home when they're feeling sick, which is absolutely critical. But finally, it really does depend on how much virus is circulating in the community. As I mentioned earlier, we have seen a reduction in our case counts with an increase in our testing over the last few days, which is encouraging. But it's always a concern when you have many, many people gathered in the same space, because as we've seen in other countries, you can have events where a single infectious person can spread to hundreds, and in the worst cases, sometimes thousands of people. And so that's exactly what we want to avoid. So again, those measures that I suggested are the ones that we need to keep following, because the last thing we want is to go from 7 new cases a day to 300 new cases a day. So we'll be watching, again, not just protests, but all activities to determine how we best continue to move forward and not back in our relaunch.
Operator, can you put through the next caller, please?
Next caller is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. Just wondering, because we are seeing quite the increase in tests being completed, if there's any plan at all in creating an online portal for people to get their results quicker.
So there actually is an online portal for people to get their results, and perhaps that's a best kept secret, I don't know. But people can actually register for My Health Records. which is an online portal that the Government of Alberta has made available for Albertans. And so anyone who is tested and is signed up through My Health Records online, and there is information on the alberta.ca website about how to register, can get their results online already. So that is actually already accessible. And I'll just double check to make sure that if we don't already have a link to that through our COVID webpage, that we include that.
Will do. Operator, can you put through the next question, please?
Sammy Hudez with the Calgary Herald. Go ahead, Sammy.
Hi, Dr. Hinshaw. You mentioned that the decision on stage 2 would be made next week, but I'm just wondering, can you outline the specific criteria Alberta has to meet before we get the go-ahead for stage 2? And also, is there any chance we see the timeline for the next stage vary by region, similar to how Calgary and Brooks moved slower in stage 1?
So the criteria are the ones that were outlined in our relaunch plan. There's 2 basic criteria that must absolutely be met. The first is that our hospitalizations due to COVID over the 2 weeks prior to the date of relaunch must either be declining or not have increased day over that 2 weeks by 2.5% a day. That's the absolute kind of minimum that they could potentially be increasing by. And the second criteria is that our ICU capacity for COVID-19, we have to be at less than 50%, and we are easily meeting those metrics. The other indicators that we do follow and make sure that we are watching closely are the number of new cases every day, the positivity rate of our testing, as well as regional case rates. And so looking to see the number of cases, active cases per population in those local areas. And as I mentioned, we are seeing a decrease in cases across the province. This is incredibly encouraging, again, due to the hard work and diligence of Albertans. And so we are looking at all of those numbers to make that final decision on stage 2. And if there were to be any particular region that was distinctly different from the others or seemed to have case numbers trending in the wrong direction, we would be having conversations with that local area before making any final decisions.
Operator, can you put through the next question, please?
Next question is Sarolta Saski with City News. Go ahead, Sarolta.
Hi, this question is for Dr. Hinshaw. So yesterday, a telephone town hall was held with sport and recreation groups. It was said in the meeting there is a strong case for facilities like arenas and gyms to reopen in stage 2 instead of stage 3. Is this true? And could we see these facilities maybe open as soon as next week?
So that conversation is accurate and is a reflection of some of the remarks that I've made previously in media, which is that sports, fitness, and recreation are areas that we are considering moving from stage 3 into stage 2. And the final decision, again, has not been made. And so, again, that final decision will be communicated early next week with respect to what will be in stage 2 and the timing of stage 2.
All right, I see we've got 2 more questions still in the queue. Operator, could you put the next one through, please?
Quick clarification, it's just the 1 question left in the queue at this time, and it's from Jennifer Lee with CBC News. Go ahead, Jennifer.
Thanks. Hi, Dr. Hinshaw. I'm wondering what you're seeing in terms of compliance as we have moved through stage 1 and are looking ahead to stage 2. Compliance in terms of businesses as they've been moving through the reopening phase. Like, are there areas of concern where you're seeing more complaints or problems? I guess I'm wondering overall, what is your impression of how these businesses are complying with your orders and restrictions?
I think like anything else, there's a mix of a response. So we see many businesses who are very diligently putting the measures required into place. We do see a small handful of other businesses who perhaps are not taking this as seriously as we might like. We haven't seen a significant uptick in complaints to our environmental public health portal, but we have seen a fairly steady number of complaints. So there certainly are some businesses who need reminders about why this is important, about the critical nature of all of us collectively reducing the risk of spread in the community. And so our environmental public health team in Alberta Health Services continues to work with businesses to remind them of that, to remind them of the measures that need to be taken. But again, I think it's a mixed experience where we have many, many businesses who are doing a stellar job and many others who are preparing for stage 2 that we've heard from, who are doing a really great job with planning and making sure that they can meet the requirements, and a few others who need reminders about the importance of continuing this, that COVID is not over, that despite the fact that our first wave seems to now be behind us, a second wave will depend on all of us continuing to make sure that we're preventing spread in order to mitigate the chance that we could see that second wave.
All right, thank you for joining us, everyone. A quick update in terms of the weekend. We will provide stats as usual online on Saturday, and on Sunday our surveillance team will finally get the day off, and Dr. Hinshaw will provide another update as usual on Monday afternoon. Thank you.